Hi, my name is Evan Callner, and my presentation is over Hodgkin's lymphoma. Before understanding what Hodgkin's lymphoma is, we have to understand what the lymphatic system is. The lymphatic system is an extensive drainage network that's a part of your immune system that defends the body against infections. Some major lymphatic organs are your lymph vessels, nodes, spleen, and thymus. We'll mostly be talking about lymph nodes, which are tiny bean-shaped structures that filter substances in your lymphatic fluid. And inside that lymphatic fluid are your lymphocytes or white blood cells. And there are two types of lymphocytes. T cells, which are produced in your thymus, which destroy germs or abnormal cells in the body, or B cells, which are produced in your bone marrow, which make antibodies to help protect the body from bacteria and viruses. And what a lymphoma is a cancer that starts in your lymphatic system and attacks your white blood cells or lymphocytes. And what Hodgkin's lymphoma is a malignant B cell neoplasm. That's where it starts from. And what a neoplasm is an abnormal growth of cells. So it's an abnormal growth of improper functioning B cells. Hodgkin's lymphoma is most common in adults aged 20 to 40, and Hodgkin's lymphoma originates in the upper body, typically in your neck or armpit. And from what I've researched, there's a high potential for Hodgkin's lymphoma to metastasize due to how B cells travel. B cells travel very quickly throughout the lymphatic system, moving from lymph node to lymph node. And once these malignant B cells are filtered in your lymph nodes, there's a chance for these to metastasize in that lymph node and produce more malignant B cells to enter throughout the body and spread throughout the body. And in research, it shows that genetics is the number one risk factor in developing Hodgkin's lymphoma. Next is radiation and chemotherapy exposure. That radiation and chemotherapy exposure could affect how your bone marrow produces B cells, and it can potentially produce malignant B cells. The hallmark sign of Hodgkin's lymphoma is a large, painless swelling in your armpit or neck. Some symptoms, the symptoms of Hodgkin's lymphoma are what are called constitutional symptoms, meaning that they affect your well-being. And those are chills, fatigue, general weakness, unhealthy weight loss of 10 to 20 pounds within a couple weeks, or that you become more ill more frequently or for longer durations. In order to properly diagnose Hodgkin's lymphoma, you need what is called a definitive diagnosis. Since Hodgkin's lymphoma affects such a small cell population in the body, just white blood cells, you would need to have a sample that has enough white blood cells for a definitive diagnosis. So a normal blood cell count to see if there's abnormal cells in there or is not sufficient, or just normal biopsy of a small piece of tissue is not sufficient. So you need to have a biopsy of a lymph node from the upper body, or biopsy of a piece of bone marrow where the B cells are produced. And what you're looking for in this biopsy is the presence of a Reed-Sternberger cell. And what these are large abnormal lymphocytes that are multinucleated, usually about 2 to 3 times bigger than a normal lymphocyte. And after the presence of these Reed-Sternberger cells are discovered, you move on to staging where you're at in Hodgkin's lymphoma. You can be either stage 1, 2, 3, or 4, which stage 1 is an involvement of only one lymph node or structure. Stage 2 is 2 plus lymph node structures on the same side of the body. Stage 3 is multiple lymph nodes on bilateral sides of the body. And stage 4 is both the upper and lower body is infected with these malignant B cells. So for treatment, the overall goal of treatment for Hodgkin's lymphoma is just to mitigate the long-term complications of chemo and radiation therapy, since there's such a high success rate of chemo and radiation. If you're caught in the early stage, there's a 90% chance, exceedingly 90% chance of survivability. If you're in advanced stages, usually 3 to 4, there's a 75 to 90%. So the number one treatment for Hodgkin's lymphoma is what's called first-line treatments, which is chemo or radiation therapy. If you're in the early stages, 1 to 2, usually just 2 to 4 cycles of chemotherapy is sufficient. If you're more in the advanced stages, you could receive a combo of chemo and radiation, which are the 2 to 4 cycles of chemo and 20 cycles of radiation therapy. That is what is used to treat it. And there's 5 to 10 cases where, after the treatment of remission, there's relapse of Hodgkin's lymphoma. And in those 5 to 10% cases, it's usually young adults that have only been in stage 1 to 2 of Hodgkin's lymphoma. So, how you treat that is just to restart the chemo and radiation over again. In overwhelmingly majority, that still works. But if in cases where that doesn't work, you would do a stem cell transplant or bone marrow transplant to replace that old damaged bone marrow that produces the malignant B cells and bring in donor cells to produce new healthy bone marrow to produce new blood cells.